Good afternoon, everyone. Welcome to the fiscal year 2023 Continuum of Care Notice of Funding Opportunity info session for local applicants in the Chapel Hill, Orange County Continuum of Care. That's NC 513. Thanks so much for being here. This session is being recorded and will be posted to the partnerships funding page once we get it uploaded and ready to go. We are going to first get started with a little bit of an overview of the Continuum of Care grant as a whole. We'll move from that into some more specific information, highlighting some areas that are new for the 2023 funding competition. Then we'll share information about the local funding process, including parties that are involved, the timeline, and then open it up with any questions or comments y'all may have. Do you have anything they want to say before we get started and dive right in? Right on.
I guess I'm curious if you've had a chance to look at it. I'm sitting here looking at the table of contents and it looks fairly identical to last year. Is it too early to ask if you've noticed big differences?
We're gonna get into this.
That is what you're getting into. Thank you. Okay.
You got it. Good questions. So first, just an overview, because there's two primary pots of funding that HUD uses to provide support for homeless services across the country. Going back a little ways, HUD went from funding things strictly at the project or program level to really looking to see how these projects are embedded across a broader community-wide effort to address the twin issues, right, of how to provide emergency shelter in the moment as really a life-saving device, but also how to help folks quickly transition into permanent housing. And so the first pot of funds are the Continuum of Care funds, and eligible uses for those are things like permanent supportive housing, which is ongoing rental assistance and utility assistance for people who are experiencing chronic homelessness, as well as the supportive services needed to help folks find that housing and then maintain it and be successful over the long term, as well as rapid rehousing, which is also financial or utility assistance, as well as shorter term case management. It's intended to be up to 6 months for short term or up to 2 years for midterm case management. Those are both currently funded using Continuum of Care funds in Orange County. And then there's also HMIS, which is the Homeless Management Information System. Orange County does not currently fund HMIS using CoC dollars. Our HMIS is funded at the local level, although we have partners across the state who are allocating some of their Continuum of Care dollars to support HMIS because it is a HUD required component of these systems and services. And then also high performing communities are allowed to get permission from HUD to use CoC dollars for prevention. That's really that HUD homeless category 3. And HUD really says, focus first on the people who are actually currently experiencing homelessness in your community. And then once you've are designated a high performing community, then you're able to start to allocate those dollars to folks who are that HUD category 3 or folks who are where we're trying to prevent the experience of homelessness. Coordinated entry, which is also a HUD required component, is an eligible use of Continuum of Care funds. And that is a component that is currently funded using CoC dollars here in Orange County. Funds, I believe, 2.5 staff members of the Housing Helpline, which provides coordinated entry in our community. And then finally, there's CoC planning dollars. HUD puts quite a few requirements on continuums of care in terms of how we're providing ongoing coordinated efforts and systems, having a governing body that is reflective and representative of people experiencing homelessness. And that is an essential component to the 4 annual reports that we send to HUD each year. And so as such, that is a funded component using Continuum of Care dollars. And there are some updates to that for this year that I'll highlight a little bit later in this conversation. The second pot of funds are those emergency solutions grant funds. And again, we talked a bit earlier about both that crisis response of what are we doing to try to get a roof over someone's head today to save some lives, but then also help someone quickly stabilize into housing. And so the Emergency Solutions Grant funds provide funding for crisis response, and that could be things like emergency shelter or street outreach, as well as housing stability activities. That could fund things like rapid rehousing or homelessness prevention. Some communities will also use ESG dollars for their HMIS or for administrative costs, although those are both not currently funded by the Emergency Solutions Grant funds that come into Orange County. So when I say the continuum of care, what does that actually mean? One is that it's a large source of homeless funding dollars that comes in. This year, we are expected to be eligible to apply for up to a little over $1 million in CoC funding. And it also refers to the area for which we are required to plan. So that's in our community, the CoC lines up quite well with the county's borders. So we're responsible for coordinating across the 3 towns and municipalities, as well as those county areas. So we're going to talk just a minute about how continuum of care funds actually run through the homeless service system or the network described as the continuum of care. So first, we've got our 3 entities here, right? So we've got HUD, or the U.S. Department of Housing and Urban Development, on your left-hand side. We've got the eligible applicants on the right-hand side. Those could be nonprofit agencies, government agencies, public housing authorities. And then down at the bottom, we have the Orange County Partnership to End Homelessness, which serves as the continuum of care lead here in Orange County. So starting off, HUD really determines the priorities and eligibility for funding competitions annually. They share out those fundings as part of the Notice of Funding Opportunity. It's usually in strong alignment with the strategic planning efforts that HUD and the U.S. Interagency Council on Homelessness develop. And then within that funding competition, there's those 3 parts, right? So there's first the project applications. So those eligible applicants like nonprofits or government agencies or public housing authorities work quite hard, as you all know, to develop those project applications of how you're looking to develop activities under those eligible uses. We next have the Orange County Partnership to End Homelessness through the Project Review Committee, reviews those project applications, and ultimately they make their way up to HUD in what's called a project priority listing. So the Project Review Committee and then ultimately the Orange County Partnership's leadership team develops a set of a ranked set of priority listings that looks at the project applications we receive, rates them for strength of and completeness of application and competitiveness, and then ranks them in accordance with local funding priorities and principles. In addition to that, we kind of wrap all of those project applications in a nice big bow that consists of our community application. So the Partnership to End Homelessness, in consultation with the leadership team and service providers and people with lived expertise of the Orange County Homeless Service System, develop a community application. And so when that application gets submitted, it's really those 3 parts: those project applications, that project priority listing, and then the community-wide application. So all of those things get submitted up to HUD using eSnaps. And then HUD does their final review of those project applications as well as the community application. They score them. They compare how our local continuum of care does with other continuums of care across the country, and then they make funding decisions based on that. Any questions about that before we dive in a little bit further? All right. So next up, just a little bit about the Orange County Partnership to End Homelessness. So we are designated as the Continuum of Care lead for the Chapel Hill Orange County or NC 513. We are jointly funded by the towns of Chapel Hill, Carborough, Hillsborough, and Orange County on a population-based formula that was updated last year to include the census numbers from the 2020 census. And we're really responsible for reporting to those 4 entities through the elected officials, those elected boards, as well as the broader public and the residents of the 3 towns and the county. The partnership's administrative home just for day-to-day operations is within Orange County, specifically within the Orange County Housing Department, which enables us to just have some really close collaboration with the Public Housing Authority, which is also housed in the Orange County Housing Department, as well as a variety of prevention programs like eviction diversion and emergency rental assistance and other items like that. So the Continuum of Care work really involves coordinating that annual funding that comes into the community to make sure that it's well aligned with the community's priorities and needs, as well as providing that ongoing coordination. As you all know very well, that involves many meetings, including our community's by name list, planning and evaluating constantly and reiterating and iterating our coordinated entry system, reviewing program performance through our data and grants work group, again, having a governing body in the leadership team that is representative and reflective of people who are experiencing homelessness in our community. Yeah, a variety of things. One thing that makes the partnership a bit unusual is that we added direct service work back in the spring of 2020, starting first with coordinated entry, which again is that kind of front door to the homeless service system. But then also adding rapid rehousing, a homeless access coordinator, street outreach, which the partnership co-manages with the Criminal Justice Resource Department, housing location services, and most recently added SOAR, which is the SSI, SSDI outreach and access to recovery intervention to help provide fast track assistance for people experiencing homelessness or imminent risk of homelessness to Social Security disability. So we're going to move next into some more specifics around the 2023 Continuum of Care competition. And we've got a lot of resources, including the NOFO and other things linked on the partnership's website. But first and foremost, wanted to highlight a couple of things for y'all. First is that as we move away or iterate away from COVID into whatever may come next, some of the lessons learned really were the need to have ongoing strong collaboration with housing and healthcare resources, because we know both housing is healthcare. As a colleague says, no one gets better without housing. And so HUD is really looking to see that that homeless systems and homeless service providers are pulling in and partnering with other funded programs, because HUD homeless dollars are not going to do it all. They also want to see that there is an increased focus both on the continuum of care level, but also on the program and project level to make sure that we're centering people with lived expertise really in decision-making roles and really sharing power in meaningful ways. HUD is continuing to focus on system performance metrics, again, specifically looking at reductions in the number of people experiencing homelessness, the number of people experiencing unsheltered homelessness, looking at the length of time that it takes someone to find housing, and also making sure that those rates of returns to homelessness after getting connected with permanent housing are low and stay low. One thing that's a little bit different this year, or it's I guess newer for some of us, is that this year the top ranked projects, or those projects that are at that tier 1, will be funded at 93% of the annual renewal demand. Last year was at 95%. And on the next slide, we'll talk a little bit more about what that means. Again, HUD is signaling again and again to project applicants pay very close attention to the detailed instructions. Again, those are posted on HUD's website, but those detailed instructions contain a lot of information that may not be in the NOFO itself. So it just provides a lot of tips and highlights areas, particularly about how to answer some of those kind of multi-part questions that HUD is famous for asking. And then there is one new eligible continuum care activity this year that is eligible, I believe, across project types. So permanent housing, coordinated entry, et cetera. And so that is the in the 2022 VAWA Reauthorization Act. There are some there's some new language around facilitating and coordinating activities to ensure compliance with the emergency transfer process. So just into the, thank you, Kat. So yeah, it's now a CoC eligible cost to facilitate or coordinate activities to ensure compliance with emergency transfer, and I think that's it. And then that new definition, but again, encourage folks to take a look at that. So to get into more brass tacks for a moment, Orange County expects to receive or is eligible to apply for up to $1,005,897 total across the categories that y'all see here. So that annual renewal demand is that if everyone who is awarded a grant through the fiscal year 22 competition had that dollar amount awarded at exactly that same level, that would account for $846,633. Orange County is eligible to apply for domestic violence bonus. And so that's new project funding that's dedicated to survivors of domestic violence, dating violence, sexual assault, or stalking. And that is that bonus amount is $50,000. And then there's a bonus amount that actually increased quite a bit this year, bless you. So that bonus funding is eligible for basically new projects, and they can be standalone new projects, or they can be new projects that are expanding an existing renewal project. And that is eligible for up to $59,000 or $59,264. And for across those three funding opportunities or project types, nonprofit applicants, local governments, and public housing authorities are eligible to apply for any or all of those. And then, so there was the bonus funding is a little bit larger this year than years past, because when I talked on the previous slide about how tier 1 funding is tied to 93% of that $846,000, the remaining 7% comes down here with this $59,000. So when HUD puts a smaller percentage of the total annual renewal demand in tier 1, that allows for more competition for that remaining annual renewal demand, or that remaining kind of $59,000. And so if the project applications and the community's collaborative application score really well, Orange County could be awarded, our total annual renewal demand as well as bonus funding. Any questions about that? Gets a little complicated,
but we as a group would need to.
Oops, Kat, you're on mute.
Oh, am I still on mute?
No, we got you now.
Okay. I was like, oh, dang. And then would it be folks would approach you as a CoC lead about an expansion, renewal, or consolidated project ahead of time?
Good question. Yeah, so all projects are also evaluated by how they consult with the continuum of care lead on their renewal project applications or their expansions. And so we can certainly have a scenario where every project applicant also creates a bonus or applies for a new project for these bonus funds, or one could or none could. You know, there's certainly existing gaps in our homeless service system, so I would hope that at least one project applicant would consider applying for those bonus dollars.
Thanks. Okay.
Yeah. The other thing that I'll say is that similar to the previous 2 years, HUD awards additional points for those for bonus projects that are leveraging healthcare resources or non-HUD homeless housing resources. So if there's a new project application that's demonstrating some enhanced healthcare services or supports, or enhanced housing supports that are non-CoC or ESG funded, that both makes for better programming for people experiencing homelessness, and makes for a better use of community resources, and results in just a stronger application. And then one thing that was kind of forecasted last year or previewed last year, there's a pretty significant increase in those CoC planning dollars this year. Again, with the typo, I apologize, but the Continuum of Care planning funds is typically tied to 3% of the annual renewal demand. But HUD this year put a funding floor, I would say, on that amount. And so the amount that Orange County is eligible to apply for as the collaborative applicant last year was about $23,000. This year we're eligible to apply for $50,000. And that is not for direct service activities. That is specifically for coordinating activities, things like strategic planning, ongoing governance, making sure that we are identifying and working towards system performance improvements, things of that nature. So moving next into local process and parties involved. So the Orange County system is continuing to build and iterate new improvements for transparency and accountability and increased community involvement. So first, the Orange County CoC has a standing project review committee that meets throughout the year to both review system performance across the year. There's an open invitation to join that project review committee, and membership of that committee has actually expanded in the last year or so. So that's something we're pretty proud of. And the project review committee has also been collaborating with the North Carolina Coalition to End Homelessness on system performance metrics. I really expect that locally we are looking at a mix of qualitative and quantitative measures in system performance measures, and adherence to local standards. And so the project review committee has really kind of dug into HMIS and to really try to see what's possible and what are some markers that where we can continue to focus our energies and attention on project performance. Additionally, applicants are invited to provide a brief presentation and be available for any Q&A that the leadership team may have. So once the project review committee reviews applications, they meet to kind of pull all of their ratings together and then rank those project applications into that kind of tier 1, tier 2. The leadership team considers those funding recommendations and makes the final recommendation for what gets submitted ultimately up to HUD. And so project applicants are invited to present, answer questions, just really share with the leadership team about how projects have maybe evolved over the year, or ways that projects are iterating and trying new things to continuously focus on improving performance, improving people's experience of participating in those programs, and improving the representation and the way that we're kind of centering the experiences and the voices of people with lived expertise of our systems, so that we're co-creating better and better over time. And then finally, the leadership team is considering the funding principles and priorities, and also provides review of the community application in the ranked project list. So moving into the CoC application. So we were talking a bit about project applications. We're going to talk next about the Continuum of Care collaborative application. There are a total of 200 points available. They're highlighted in a moment, but there's no terribly significant reallocation of points for this year compared to last year. So again, that CoC application, there's specific project applications we'll get into in just a minute. And then there's that Continuum of Care priority listing that ranks new projects. Again, those are things that could be reallocated if a renewal project is reduced or reallocated altogether. CoC bonus, as well as the DV bonus, and then also those renewal projects. So those all require ranking by the project review committee. And then the CoC planning grant is not ranked. There's really only one applicant who can apply for those planning dollars in the community. So the different funding sources have different eligible project types and ramifications. So at this point, again, we've got a permanent supportive housing program, 2 rapid rehousing programs, and a supportive service coordinated entry program that are all eligible to apply for renewal, which is where you're just applying for a straight, we received this last year, we want to renew at the existing amount. Or folks are able to apply for a consolidation if you're no longer interested in serving that number of households again, although that would have needed to have been signaled to the HUD field office during the grant inventory worksheet submission. And then expansions. So those expansions are really where we are taking that renewal application and combining that with a new project. That's something that HUD kind of does on the back end. And we can talk about that in just a second. Again, we talk about new projects that are funded either through reallocation, through DV bonus, or through the CoC bonus. And so when project applicants are applying for a bonus, it can be, again, like a standalone, like you're trying a new pilot of a new thing, or it could be an expansion where you're saying, please combine this new bonus project with our existing project. And then HUD will combine those on the back end into one grant moving forward. So we're going to talk next about some eligible costs. Those can be things like capital costs, purchasing, leasing, operating, rental assistance. And again, the length and type of rental assistance we can provide varies a bit by the project type, whether it's permanent supportive housing, rapid rehousing, or transitional housing. Services that can fund things like outreach, childcare, supportive services, case management, housing search and placement. Again, encourage folks to go directly to the NOFO and through to the HUD regulation for what exactly services are enabled. But just know that, again, it varies a little bit based on the project type. Again, homeless management information system. So that is the database that HUD requires for its CoC and ESG funded projects. That also enables us to provide some of the annual reports to HUD that we submit, including the longitudinal systems analysis, the system performance measures, the point in time count, and housing inventory count. And then also project administration is an eligible cost because we know that that's a necessary part of running programs effectively to serve folks. So we're going to talk a little bit about the specific project types and the funding criteria. HUD has changed these a bit this year compared with last year's funding competition. So again, just as a kind of refresher, permanent housing, again, doesn't necessarily mean that once someone is able to exit homelessness into permanent housing, that they never move ever again. It simply means that when someone moves into housing, there's not a predetermined exit date in mind. So that's what really differentiates permanent housing from transitional housing or temporary housing. And so both Permanent supportive housing, which is again those ongoing offered intensive case management and rental assistance, as well as rapid rehousing, are considered permanent housing programs. They both permit people with lived experience of homelessness to live as independently as possible. And there's some pretty critical components of housing first, where someone's housing is not bound up in the way they are participating or not in services that are offered. It's also designed to be, like I said, community-based housing, so a non-institutional housing, but housing that could be available to anyone in the community without a designated or predetermined length of stay. And that ideally that there are leases that are a year or more that are renewable and terminable only for cause, not for things like non-participation or failure to meet sobriety requirements or things of that nature. So again, permanent supportive housing is that housing assistance and supportive services for people who have lived experience of homelessness, or specifically chronic homelessness, who also are living with some type of disabling condition. Case management could be required for some initial period after exiting homelessness. And really, assistance from permanent supportive housing should only be terminated in the most severe cases, if at all. HUD, as well as the state ESG office, really look at what do our grievance policies and procedures look like? How are we educating folks about what are the things or what are the scenarios in which someone could potentially jeopardize that housing? And really looking to make sure that we've got some fulsome and robust programming and process, so that if folks disagree, that there's a space for hearing those things out. Eligible costs under permanent supportive housing are things like acquisition, rehabilitation, new construction, leasing, rental assistance, operating costs, and supportive services. HUD did forecast at the National Alliance to End Homelessness Conference the other week that there is likely to be a new PSH specific funding opportunity getting announced in the fall that will focus on capital and acquisition. So yeah, we will share that information out as soon as we get it. Pretty exciting to hear. So moving next to the other type of permanent housing that HUD CoC dollars will fund, and that's rapid rehousing. Like I mentioned, that is temporary rental assistance and or services, can be a mix of anywhere from 0 to 24 months of rental assistance. And those supportive services are available for up to 6 months after someone's rental assistance ends. So there could be a household who maybe newly is experiencing homelessness, they find employment and no longer need assistance to pay rent or utilities, but could benefit from some ongoing supportive services or case management. That's allowable for up to 6 months after that rental assistance ends. Pretty primary provision here is that the client or participant remains in the unit after the rental assistance or case management ends. So oftentimes folks are able to move into a unit, you know, the lease is in their name, and then able to remain there even after they are no longer participating in a rapid rehousing program. And then that at least monthly case management is offered. Again, there's no service participation requirements. Service providers are expected to demonstrate that they have provided at least monthly offers of case management or connection, just in case someone is, is interested over time in finding ways that they could potentially benefit from those supportive services. Exceptions to this are where that is prohibited by the Violence Against Women Act and the Family Violence Prevention and Services Act. So there's a new component to the funding criteria, or how HUD is really scoring project applications this year. Last year, it was at least 3 of the 4. And that is where this year it's 4 of the 5. So what remains is that the type of housing proposed meets the needs of the clients. Again, making sure that if your project is expected to provide support to families, that you don't all have studios or one-bedrooms. But you've got a mix that is reflective of the population you're intending to serve. Also making sure that you have the services sufficient to ensure the transition to and retention of permanent housing. Again, that those services are individualized and client-centered, and that they're the right types of services that will help someone retain that permanent housing over time. Also really looking to see how the projects are connecting folks to mainstream resources. And again, that by mainstream, we just mean not homeless specific. So those could be supported, or those could be employment services or childcare or education or vocational rehabilitation or SNAP benefits. Just really looking to see that we are having homeless services kind of embedded in the broader social safety nets that we have across our communities. Also, that again, looking to see that folks are getting assisted in obtaining permanent housing. And then the new element for this year is HUD is looking to see that the average cost is reasonable. That's one component that folks may remember from the scorecard. And HUD has provided a little bit more, they've operationalized average reasonable slightly more this year, by which they mean that the cost for housing and services is consistent with the population that's served. Again, so that's not necessarily a discrete dollar amount, but that's consistent with who's getting served and how they're getting served. So the next program component is the joint transitional housing rapid rehousing program. And so this is not a component type that is funded in Orange County. Certainly it's eligible, but it's not currently funded. And that is where an agency provides both transitional housing as well as rapid rehousing. Participants can choose one or the other, but the agency must make both available to all participants. And in order to fund a project type like this, HUD is really looking for 6 of the 8. So most of this has remained consistent over time. A little bit of this is new. So again, that you've got the type of housing that meets the needs of the clients we talked about earlier, that we've got the services that are sufficient to assure transition to permanent housing, that we're not just kind of pushing folks into transitional housing and leaving them there, but that again, we're really focusing on permanent housing as the goal, that we are working together to help with connections to mainstream resources, and that participants, again, are assisted in obtaining permanent housing. Also that program approaches are really embracing housing first practices, and HUD makes a really great housing first assessment tool to that end. Also that supports are individualized, right? That not every household is getting referred or connected with like the exact same types of supports, because folks' needs may be different. Again, HUD has added that average cost is reasonable. And so the same kind of definition applies that we talked about in the previous slide. And also to ensure that there's enough rapid rehousing to ensure that every program participant who moves into transitional housing could move into a rapid rehousing unit if they wish. And the way that projects demonstrate that is by having twice the rapid rehousing budget as they do a transitional housing budget. So if you're funding, 5 units of transitional housing, you want to make sure you've got at least 10 units funded for rapid rehousing. We talked a bit about housing first. Just want to, that you all know quite well, but just want to kind of highlight that a bit. Again, housing first, make sure that we are prioritizing rapid placement into permanent housing. We know that folks who are living, particularly folks who are living unsheltered, are much more likely to experience just worse health outcomes, experiences of violence and things. So we want to get folks as quickly as possible into permanent housing. We also know that folks will be more likely to be successful if that housing is operated with low barriers, and that there's not a lot of preconditions to program entry, right? We're not requiring folks to have income, we're not requiring sobriety or participation in certain types of programming, and that we're not requiring folks to kind of participate in kind of a stepped up approach. We see that not infrequently, that folks have to kind of prove readiness or prove their focus to go from one type, a 7 p.m. curfew to a 10 p.m. curfew. Like, no, there's no evidence behind that, and in fact, that just contributes to people experiencing homelessness for longer. And again, if this is kind of newer for folks, happy to talk more about Housing First, but just have a link here with the HUD Housing First assessment tool that enables programs who are either kind of new at this or have been doing this for a while, but want to kind of check and see how they're doing. And that assessment is divided into how folks access your programs, how those programs are getting evaluated, what kinds of services you provide, what kinds of housing and leases, as well as some project-specific items. Definitely encourage folks to check that out. So we're going to move next into the next project type, and that is coordinated entry. HUD actually refers to that as supportive services only, of which coordinated entry is one of the funded elements of supportive services only. And so that means that we really have a centralized process that's designed to coordinate client intakes, assessment, referral, and that coordinated entry system covers all of the continuum of care. So we're not just focusing on people living in the southern part of the county, but really that is a system that is easily accessible by people who are in housing crisis across the county. Also, that system needs to be well advertised and needs to really utilize the standardized assessment tool. Orange County is currently using the VIS for that, but we need a standardized element to help kind of compare apples to apples, and has really been a key component of moving from programs that are first come, first serve into seeing how systems work or communities work as a system that is really trying to prioritize people who are most vulnerable for the highest levels of supports and services. And so when HUD is looking at those supportive service only project applications, they're looking for at least 2 of the 4. Again, more is better with all of these funding criteria. But first, the coordinated entry is easily available and reachable for all folks within Orange County who are seeking homeless assistance, and specifically making sure that it's accessible for people with disabling conditions. So there's options around, text to type or reducing any mobility related issues that folks may have accessing. Also looking to make sure that there are strategies in place to specifically reach people who are experiencing homelessness who may have the highest barrier to a more traditional service delivery model. So not everyone's going to be able or interested in walking into an office necessarily. So making sure that we've got some really assertive outreach and mechanisms for reaching folks who've traditionally not been served well by these types of systems. Again, make sure that we have a standardized assessment process and that clients are directed to the appropriate housing and services that fit their individualized needs. So do you have any questions about the funding criteria that HUD will be using for those different project types before we move into the local process and timeline? All right. So next. So HUD released the NOFO on July 5th, the day after July 4th. And HUD requires us to have more than one deadline. So the overall deadline for when all of the package that we talked about earlier, those project applications, plus the communities application, plus the project priority list are due to HUD no later than September 28th. Our requirement, or one of our primary charges as a continuum of care, is to have a local funding competition, and that local funding competition projects cannot be due into the continuum of care later than 30 days before that overall deadline. And then HUD also requires that the CoC provide written notification to project applicants no later than 15 days before the overall deadline. Again, that's where we really want to make sure that process is open and transparent and is really collaborative, right? Is really enables a lot of collaboration and a lot of time to make sure that both the project applications can be the strongest they can be, but also that the community's application, that there's ample opportunity for community members and stakeholders to really weigh in and make sure that our projects and priorities are well aligned with the needs that we're seeing in the community. So when I mentioned that those project applications are due in locally to the partnership as the CoC lead. So project applications and the supplemental documents are due on Monday, August 21st at 12 noon. And those can be emailed to our walls. And I'll have my contact information on the website as well as at the end of this presentation. And that consists of all of the information that's listed on the partnership's website, including a PDF of the project application that you have ready to go in eSnaps, not that you've submitted, but that you've got ready to go in eSnaps. And I just saw a notification from HUD this morning that that's now open. Also that there's some supplemental documentation. So there's a grantee certification. And again, some of the supplemental documentation varies a bit based on the agency type, whether you are a nonprofit applicant or a unit of local government, what project type you're applying for. So there's a permanent supportive housing certification that does not necessarily need to be completed by rapid rehousing project applicants or supportive service only applicants. As well as whether you are submitting a new or renewal application. Any questions about that before we move into kind of the next steps? So next, after applicants turn applications in, CoC staff works to review those applications and may reach out to request some clarification or suggest improvements for a number of reasons. One, HUD requires us to. It allows the continuum of care to really know what is getting proposed and also provide input around that ties what applicants are proposing to the needs and the volume and the types of households that we're seeing across the continuum of care of who's experiencing homelessness in the community. HUD also scores the entire community based on the project applications. And so there's a lot of just interdependence on us as a system. So when project applications are strong, that supports the performance of all of the other project applications and the community as a whole. And then it also allows us to maximize points within competition. The community application scoring considers only what's submitted by the local deadline. But again, there's a good chunk of a window between August 21st, when applicants submit your applications, and when they're ultimately due to HUD at the end of September. So that gives a window for CoC staff to review them, the project review committee to review applications, as well as a chance to hear from and benefit from the review of the leadership team. So our local timeline for the CoC FY23 competition, information was sent out to local service providers via email, posted on the partnership's website, tweeted out. If y'all have other ideas about how to get information out there, always happy to hear it. Back on Monday, July 10th, we've got the local applicant briefing today. I'll be uploading a recording later today or tomorrow morning. And again, if y'all have ideas about how to make sure that this information is getting out, again, happy to hear it, want it to go far and wide. To just make sure we're continuing to have a good, healthy competition while working in concert and in partnership day in and day out. Again, those project applications are due by noon on Monday, August 21st via email. And then from there, the project review committee scores those project applications, and they'll be meeting the week of basically Labor Day week to formulate their funding recommendations and their project ranking. The Orange County Partnership Leadership Team will receive that ranked list when they meet on September 11th, Monday, September 11th, as well as review scorecards, and they may have additional questions or comments. And so project applicants are invited to that September 11th meeting to be on hand to answer questions, provide a 5-minute presentation if y'all would like. But then partnership staff will be notifying applicants in writing of whether your projects were included in the CoC application. Well, they're always included, but where they were ranked and what type of funding is recommended, as well as share any feedback that the project review committee and the leadership team may have, again, for the purposes of strengthening applications. There is an appeals process, and I'll share that in writing as well. It's the same as we had last year. Then that gives project applicants another about week and a half to incorporate any feedback that you may have received into your project applications. And we ask that project application revisions are completed by Monday, September 25th. HUD requires us to post the community's application as well as project applications, scorecard, and project priority listing at least 2 days before the HUD final deadline. So our plan is to post all of that on the partnership's website by Tuesday, September 26th. And then the partnership plans to submit the CoC application to HUD in advance of the competition deadline on Thursday, September 28th. Once we post all of that, y'all will be able to hit send on your respective eSNAPS applications. But here is local deadline. And let's see. So a couple tips for folks who are, I don't think this is either of your first rodeos, but regardless of that, there's always good tips in the notice of funding opportunity. So I encourage everyone to read that. Also make a plan for completing your project applications. If you're looking to do a straight renewal, that is, there may be one kind of set of timeframes that you would want to consider there. If you are thinking about applying for expansion funding through either the DV bonus or the CoC bonus, please reach out and talk to me. We're happy to bounce ideas, make any connections I can to help housing or healthcare resources, again, to make sure that those bonus applications are well suited to the needs and priorities of the community. Definitely encourage you to consult with the rating and ranking tool. We've got the metrics listed there of how projects will be evaluated. We're going to talk about those next. And then also make sure to check out the partnership's CoC application page. I update that with documentation, resources when I get them. So definitely keep an eye out on those as well. Any questions about that before we move into the rating and ranking tool? I see some no's. All right, let me get out that. And I'm going to move next into rating and ranking tool. All right. So we are now back. So you heard me talk 18 times about the partnership's website. Here we are. So it would be where we would land. Then you go to the CoC funding, current CoC competition. Again, we've got our background information, the funding that's available and who's eligible to apply. How to submit your application and application supporting materials, our local timeline. Encourage folks to check out the detailed instructions and navigation. eSNAPS navigational guides are posted on the CoC's program competition site. Moving next into the, we'll first talk through the CoC's new project thresholds. And then we'll get into the local scorecard specifically. These are all elements that HUD makes the final determination as to whether the project applicant has met the the new project threshold requirements. So these should look pretty familiar to y'all, but that the applicant has an active SAM registration, has a valid EIN number, that the project is eligible based on nonprofit documentation status or as a local unit of local government, that agencies have the financial and management capacity to carry out the projects as submitted in the project application and administer federal funds, that project applicants meet the required certifications as spelled out in the NOFO, and that you're serving the population. Again, we're talking about people who are currently experiencing homelessness. So it's categories 1 and category 4. That applicants are participating in HMIS unless explicitly not able to do so as a victim service provider. There are no outstanding delinquencies on federal debts unless you meet these other 2 conditions. That the project applicant has no disbarments or suspensions. That there's a pre-selection review of performance, and HUD again reserves the right to deny funding, require the removal of individuals who are associated with the implementation of the awards, or make other provisional or other revisions associated with payment. And a couple more. One, that the financial management system is sufficient, as indicated by the standards that the federal government needs. That there are no false statements in the applications. There's mandatory disclosure requirements around fraud, bribery, gratuity, conflicts of interest. There is the federal prohibition against lobbying activities, the equal participation of faith-based organizations in HUD programs and activities, and the requirement that outstanding civil rights matters must be resolved before the application submission deadline. So those are all determinations that HUD makes at the federal level. Some of the CoC required thresholds are that agencies are participating or for new projects are intending to participate in coordinated entry, that that program design and implementation is considered low barrier and housing first, that there's a documented secured minimum match of 25% for the CoC award, that the project has reasonable costs for permanent housing exit, project's financially feasible, that the applicant is an active CoC participant, and we'll get into how that gets measured, that the application is complete and that data is consistent, that data quality is at or above 90%, that there's an acceptable organizational audit or financial review, and that the applicant has experience in effectively utilizing public funds. So those are the threshold measures for new projects. We'll move now into the actual scorecard itself. Let's see, I'll make this bigger and then probably bigger again. All right. So again, this scorecard is available on the partnership website. It should look fairly familiar to y'all. And I've just got it right now. I've just got it sorted by project types, by new projects, and then I can sort by renewals. That just adds a few different elements, but most of the elements that you'll see here are for all project types. Again, that applications are complete and consistent, that agencies participate or plan to participate in coordinated entry, as indicated by attending 75% of the coordinated entry planning meetings and home committee meetings in a 12-month period from July 1 through June 30th. That project services are aligned with Housing First, and that agencies participate in the cross CoC monitor and pilot. Talked about the documented match. Just note here that for the Emergency Solutions Grant, the state covers that match, but it is still a requirement of the Continuum of Care funding competition. Next, that the project has reasonable costs. So somewhat new for this year is asking applicants to just note other funding sources for program costs to give the project review committee a more complete picture of kind of what and how things get funded. I'm also looking to make sure that the project is financially feasible, that the applicant is an active participant in the continuum of care. We've got, again, our metrics here with that the agency attends 75% of leadership team CE planning and home committee meetings, that the agencies participate in the point in time count and housing inventory count, consult with the CoC on the community's application, and that the project aligns with the CoC's goals, and that the agency fully participates in coordinated entry. I'm realizing I want to keep these up so y'all can see that a little bit better. All right, now we're cooking. Any questions so far?
Yeah.
I'm sorry, was that a question?
There's 2 rows frozen.
What's that?
It is better with the first 2 rows frozen.
My old ears, thank you. Next, that there's, again, the acceptable organizational review. And then we've added that the agency applies a racial equity lens as a threshold measure. It used to just be a pointed element. Now we're really using it as a threshold of, we're setting kind of the floor of how application of racial equity work gets brought into homeless services. We also added the increasing knowledge base on racial equity as a threshold measure. The points remain on both. And then one thing that was new for this year was actually pulling out that the agency has people with lived experience of homelessness in decision-making positions. It used to be combined with this racial equity lens. So again, just right now we're looking at that based on make sure that at least one person has lived experience of homelessness on the board of directors. Also looking again at moving into how the project is aligned with the continuum of care. So does the project conform with the CoC's written standards, and that agencies are able to demonstrate knowledge of how those written standards affect the programming. There's documented financial stability. The applicant has experience working with people in housing crisis and providing housing and or other services. Yeah, no major changes to these. Experience effectively utilizing public funds, a demonstrated understanding of client needs, the type and scale of the project services meet clients' needs. Again, looking at those connections to mainstream benefits. Looking at how we really incorporate and address barriers to program participation and rapid placement into permanent housing. So we can, again, really try to increase the engagement and expertise of people who are currently using or participating in our programs to making them better and stronger. Also that we are looking to assist folks with obtaining permanent housing as quickly as possible, increasing client income, and noting that in HMIS, that's a twofer, as the project review committee noted recently, that it's both, noticing or capturing those increases in income, but also how we're capturing that information via HMIS. And then specifically for new project applicants, making sure that the project can gear up and start quickly so that the agency is able to start the program within 60 days of contract execution. And as you all know, there's usually can be a bit of time between when the award gets announced by HUD, usually in the spring, February, March-ish, and when the contract gets executed. So there's a good bit of time there to act. Any questions about the scorecard as new applicants? Y'all want to move next into for returning applicants?
Yes, please.
Some micro nods, some macro nods. Okay. So I'm just going here again to the scorecard and selecting renewal, and then unselecting if that's a word new. So for renewal projects, certainly a lot of the same threshold measures. What is relevant for those for those renewal projects is a lot of the program performance. They'll have had a chance to execute programs, see how they're performing over time. So we've got the elements themselves through here. And then I just want to highlight the maximum points available down here. So when the review committee looks at projects and says, we move for a consensus measure, so that every project review committee member who does not have a conflict of interest with any of the applicants, they score. We look for unanimity as to whether project review committee members say that this metric has been met or this metric has not been met. And then we just look at the total number of points that an applicant has earned, and then divide by the total number available to get a percentage of the maximum points. Any questions about that math? Okay. Again, just in an effort to kind of make sure we're comparing apples to apples a bit, because not all elements necessarily pertain to all the project types. So I may, since we've already talked through the measures and metrics for all, I'm going to move down into the renewal specific elements, if that's okay with folks. And I'll also highlight if there were any new changes. So we're doing the same piece first for program entries from coordinated entry referrals, just doing a spot check to make sure that at least 95% of the program entries are coming from coordinated entry. We talked about these earlier. So I'll move next to the next renewal, which is high HMIS data quality. So looking to see, and this relates to the data quality plan that was implemented this spring. So this was added as a threshold measure. So just we ask folks to say, yay or nay, that they have regarding implementation of the data quality plan, and then looking at those null values or data values. One caveat I wanted to note at the request of the project review committee, we know that folks may have some very good rationales for refusing to provide full or even partial social security numbers. The homeless service system, both in Orange County and across our implementation, certainly has an interest in allowing for more information to allow for deduplication of client records. However, we want to really honor folks' really critical reasons for refusing. And so when we look at the data quality around social security numbers, we subtract when clients refuse from the total number of errors. So basically that doesn't count against programs because you may have clients served who refuse to provide that social security number. Any questions about that? The next element is looking at high bed or unit utilization. Our metric or rubric is that emergency shelter beds are at 80% or above. I was talking with the NCCH staff about this for PIT in terms of how to get that measure, because the only one that we have currently is PIT night. And so this is what we're using for now. I think there's room for a follow-up conversation with the data and grants work group for ways that we may want to revise this moving forward, because Kat, you may know this, when we look at the housing inventory count, which gets us utilization for rapid rehousing and permanent supportive housing. Actually, Stephanie, you know this too. HUD only counts when there's a head in a bed that's housed through rapid rehousing or permanent supportive housing. So y'all are always at 100% based on the housing inventory count. which again, I think when we're getting to like the spirit of the metric around utilization, we may, yeah, I think we'll do some workshopping on some better measures.
Okay.
Does that make sense? Okay.
Yeah, I mean,
So
I don't, Steph, you guys, well, never mind.
I'm just saying, for example, so let's say, for example, IFC's permanent supportive housing program was serving 20 households. Let's say 19 households were leased up and housed on pit night. IFC's PSH housing inventory count on pit night would be 19. So it'd be 19 out of 19 at 100%. So it's, anyway, it's a little bit funny. We'll keep working on it.
It seems like it's developed for folks who have their own housing stock.
Yeah. I think it's just not a great measure of like, are your case managers working to their full caseloads, for example?
There we go.
And are they at 100% lease up? You know, anyway. Data and grants, project review committee, and then maybe scorecard for the 2024 funding competition. Also looking to make sure that projects are spending funds that are awarded and that we're not returning funds unnecessarily back to HUD. That the exits to permanent housing are, as indicated by the rubric here, rapid rehousing, 90% or higher, homelessness prevention, 75%. The other two types do not apply in this funding competition. Next, for permanent supportive housing, that we've got those exits to or retention of PSH at 90% or higher. Big one I'd want to drive home is increases in income. So each of these next elements is 2.5 points and is broken down a bit by project stayers and project leavers. And then it's further broken down by the difference between earned income and non-employment income. Anytime someone may have a cost of living increase or a change in SNAP benefits, those can be entered into HMIS and be captured in income changes here. So definitely want to highlight that. If we need to flag that or reflag that or have conversation with PSH and rapid rehousing case managers, happy to do that. But those elements here, increases in earned income, the metric is 8%. Increases in non-employment income are 10%. Next one to flag is the number of days from project entry to project to housing move-in. It is, the expectation is 45 days or fewer as a median rather than the average. Next, looking at returns to homelessness at 15% or less. Couple of things next, looking at the length of time in program. Neither of y'all are currently funded for transitional housing, so neither of these would apply for now. I'm going to move now into participants, kind of who we're serving and are we serving, our programs serving the most vulnerable folks. So for rapid rehousing, permanent supportive housing project types, as well as shelter transitional housing and homelessness prevention, we're looking to see what percentage of participants had zero income at program entry, as well as what percentage of participants have more than one disabling condition, and then what percentage of program participants are entering from places not meant for human habitation. And then our last metric is making sure that there's an appropriate number of clients per case manager to allow for high quality case management. So those are all of the renewal project metrics. Folks have any questions about those? No. All right.
But it does concern me a little bit because of how I know that we've got that thing where rapid rehousing income doesn't need to be recorded in the first year. We only really start calculating it in the second year. So for everyone who's enrolled, I'm curious what that measure will look like. But
yeah,
we had to see.
Yeah, that's a good question, Kat.
Because everyone on SSI got a COLA this year. You know, so anybody in that category would register that increase in income, but I'm sitting here thinking we might not have gotten their letter the first year.
Right.
Or whatever, not logged it in that way. We always need the income because we need it for home searching. But you know, it might not be in the HMIS. So
yeah. There may be, I'm gonna take off screen. Is there anything else? And when I continue that question, Kat, is there anything else that y'all want to see here for now? Again, we'll post the meeting notes and the project priority listing once the project review committee meets and then the leadership team meets. Like I said, the HUD announced today that the detailed instructions should now be available. So you can find those in the application supporting documents. They still said. There we go. Oh, they said coming soon. There we go. Awesome. Yeah, so I am, Kat, other than your question, do y'all have any other questions? Stephanie, everything coming up? Otherwise, I'll pause the recording and go from there. All right, Kat, we can review the APR for rapid rehousing in particular and see, first see what it looks like, but then also talk through, just because we don't need to necessarily collect that information for program eligibility, it still, I think, could be relevant from a program performance standpoint of like capturing that information as a baseline and going from there.
So yeah. For some reason, I'm just tuning into it more thoroughly this year.
Yes, yeah, that's all right. All right, I'm gonna stop the recording. Actually, that's not true. I'm gonna go back to the PowerPoint so folks have my contact info.
There we go.
All right, rating and ranking tool. We've talked through, got a wrap up, and my contact information is here, rwaltz@orangecounty.nc.gov or 919-245-2496. Otherwise, appreciate you being here and wishing everyone a happy FY23 CoC funding competition. Thanks so much.
Thank you.